Hello everyone. Today we will be discussing the superficial heating modality, moist hot bath. This is the most commonly used modality in the physiotherapy department for the relief of pain and spasm, and it is mostly used prior to giving any stretching or mobilization of the stiff joints. So moist hot pack, mainly it is a conductive means of delivering the moist heat to the patient, and the packet is made up of the canvas and filled with the silica material having the hydrophilic properties so that the heat can be retained quite for a long period of time. So mostly it is a pack made of canvas, and it have portions which is filled with the silica material, and this material helps to retain the heat for a longer period. Mostly these packs, they are immersed in a thermostatically controlled heating unit, which is also called as hydrocollator unit, and the water temperature is between 70 to 80 degrees centigrade, and the pack is capable of retaining heat for approximately 30 minutes. So these all packs, they are kept into that hydrocollator unit for heating up, and these moist hot packs, they provide superficial heat up to 1 to 2 centimeter in depth, and they are primarily applied over the flat and large body surface areas. The method of the heat transfer is by the conduction. So for applying the moist hot pack, the basic material required is, first is a hydrocollator unit. This is a hydrocollator unit. The various shapes and sizes of hot packs, they are available for different parts. There are different moist packs or hot packs available. Then sometimes there is commercially hot pack covers. They can be available or used in the department. But if you don't have those commercial hot pack covers, we can use the towels, and mostly the two towels, they are used for one commercial cover. Then we can go for any, if we need a timer or call bell or any alerting device can be used, if so that the patient can uh, call you, or they can ask you for help if they are feeling more heat. This is hydrocollator unit. These are the various different size and shapes of hot packs. So next is the instructions for moist hot pack application. So initially we explain the procedure to the patient. We tell the patient what kind of a sensation is to be expected during the treatment. Mainly the mild warmth is the sensation that we require from the patient. Any overheat experienced is need to be reported immediately to the physiotherapist. So we have to explain the procedure, what kind of sensation the patient will be feeling. Then we inspect the area to be treated for any open wounds, cuts. Then we check for the level of sensation to the temperature by test tube experiment. Then we ask the patient to remove jewelry or clothing from the area to be treated. And then we position the patient appropriately, comfortably, and modestly. Then we cover the area to be treated with a clean terry cloth towel. And we remove the hot pack from the hydrocollator unit by using the tongs on the pack. Then we wrap it into 6 to 8 layers of dry toweling, or sometimes 3 to 4 layers of commercial hot packs. They are covered. We cover the hot packs because we need to protect the patient from the burns or overheat. So we place the pack on the top of the body part to be treated, and if we secure it well. So it's always best to place the pack on top of or over the body part. Then we also provide the patient with a bell or some alerting device so that the therapist could be called upon if he needs any adjustments, or also the therapist need to check the skin periodically during the treatment. And during the application of heat therapy, during the application of the heat therapy, the patient is supposed to feel a sensation of mild warmth. So the patient should not feel excessively hot or feel any sensation of increased pain or burning. So if any of these sensations are there, we immediately discontinue the treatment or we reduce the intensity of the heat. And the treatment duration, it is mainly between 15 to 20 minutes. And if the packs have to be reused, we need to preheat again. Then we check the patient and the treated area after first 5 minutes. And for comfort, signs of excessive redness, mottling, or signs of first burns, we need to check that. So if there is such things, so this indicates that the pack is too hot or the additional towel layers may be added. So mostly the intensity is governed by the patient's tolerance only, and we can accomplish it by adding or removing the layers of the towels. At the end of the treatment, we need to remove the pack, dry the treated area, then we check the skin condition again, and any signs of excessive redness or anything like that had to be noted and reported. Then we remove or return the hydrocollator pad to the heating unit, and we allow at least 1 or half an hour of reheating before using the pack again with the patient.